Doctors don't always tell patients about trials, and so they're not aware that they're there. And then obviously then they have to understand what trials are all about. So one of the things that we have is our Clinical Trial Support Center. These are nurses that have been trained in not only clinical trials but also in the hematological malignancies, and what they do is they will work with patients one-on-one to get them the information on the trial. They'll do trial searches for them. They will work with them to see what their exact eligibility is for the trial, so they'll do medical histories with them. They will narrow it down to a really good number that they can work with, that they can then take back to their physician to discuss it with them to see whether or not it's right. They will also continue to work with them throughout the process. So if there are issues with getting into the trial, maybe some connections with the PI, they will contact the PI, they'll contact the institution. If they need assistance maybe with financial aid, they'll see what they can do with that. There may be an issue with lodging because the trial is very far from where they live. So they will work with them from the time they call and say that they're interested in a trial all the way to the point that they're either enrolled, or in some cases that may not be the case. There may not be a trial that's appropriate for them, or they may not be appropriate for the trial. But they have about a 60% enrollment rate for the patients that contact them. So that's our Clinical Trial Support Center.